different grants, demos, or pilots out there that where it makes sense for local communities to partner with other organizations to try to take advantage of some of them. So it's there's a lot of focus I mentioned on primary care, preventive care, and they do that through investments in training and a workforce. The community health centers got a whole lot of money, both to expand the number of sites as well as to build capacity of current sites, and we know that it's a great access point for the safety net population. There are these things called the community transformation grants, which so this is a grant program for state and local government entities and community-based organizations to implement, evaluate, and disseminate some evidence-based community preventive health initiatives to both address health disparities and chronic diseases. So this is a grant program that community-based organizations can apply for if they can do any part of what I just mentioned. This is something that there's no authorization for itself, but it's something that's going to be funded through the $7 billion prevention fund plot, which I don't know if you will follow the news, but there is a bill out there now to both not only defund that, but to deauthorize that prevention fund. So this is something, against another one of our issues, we're fighting against the repeal of this particular section, mostly because it's the investment that's going to make all of the delivery system changes that the Affordable Care Act want to incentivize, make it actually work. Is there a question? Or you look
no,
perplexed?
I'm just thinking about the impact of the local community.
Exactly.
When we're implementing some of
we were
the
very
programs.
happy that it was first in there. It's the first time they threw like that amount of money at prevention in a community at the community level, and it's sad that it's currently.
What is community transformation grants?
So this is the one I mentioned that it's going to focus on chronic disease and health disparities. So it's if you have ways to, what's listed. There is an additional detail we talked other than what's already in the legislation right now. So it's preventive health activities. They have to be evidence-based, but this is involving people going into the community, into the homes, and helping the patients to navigate some of the challenges they face if they have multiple chronic illnesses or with some of the other challenges with this population, especially with health disparities, and they can't navigate the current system.
There are some planning grants out now. We just partnered with our major healthcare system in the city of Roanoke for a planning grant, which includes the community needs stuff. So some of those things, at least the applications are out and now submitted. Now whether they're going to take the money, whether the money will be there or not to fund them, is the big issue.
That's the question.
Is it?
Because this is being funded through that $7 billion, what the Republicans call a slush fund.
But there is now, I guess my question would be, do you know if the funding applications are going up for the community transformation applications yet, or?
I don't know the answer to that question off the top of my head, but I'd be happy to look it up.
We'd really like to know that.
Get back to you. Yeah. And then, so of these, I guess I'll just mention you all know about the community needs assessment. I understand you guys are going to talk about it a little bit more in the panels, but there's a 3-year demonstration for expanding uninsured access, so providing comprehensive services to the uninsured. This is, both for hospitals, but as well as a public-private partnership where the community can get involved in where they know what the existing resources are to leverage some of them. And then if you want to skip over a whole bunch of slides, over to the next opportunity slide, there's a whole bunch.
And we're going to have this.
Yes.
Could you distinguish briefly between the Medicaid health homes and the Medicare medical homes?
Sure. The Medicare medical homes is broader. It's basically a primary care locus for the patients where the practitioners within the medical home would do the job of coordinating the care for that population. Whereas the Medicaid health home is a little bit more limited. It first of all, it's a state option, which means your state has to get involved to amend their Medicaid plans to do this. And second of all, it is only for setting up medical or health homes for individuals with multiple So they'll do a 90% match for 2 years. So whatever cost of running this program is for 2 years, you'll have a whole lot more federal funds. So this is the last section of my presentation, and it's getting to some of the earlier questions about the delivery system transformations. There's a lot more delivery system transformations, but the ones I've listed out here are, I think, where opportunities exist for community organizations to partner. And I mentioned the ACO, the Accountable Care Organization. We don't know what the Medicaid pediatric one will look like, but we do know that the Medicare one, CMS is proposing any group who's coming together to form ACOs to partner with community stakeholders, and to partner by having a community stakeholder on the governing board. So that's a big it's a big requirement. And on the provider side, it seems a little onerous, but it's definitely good on the community based organization side. Readmission's not a program, and I mentioned this is because actually, I don't know if many of you followed, but HHS just announced the Partnership for a Patient initiative, where they're going to reduce hospital-acquired conditions by 40% and reduce readmissions by 20%. They've thrown $500 million over 5 years into the reducing readmissions through this community-based care transition program. So this is another program where providers can't take advantage of, but they need to partner with a community-based organization who has experience in the care transition of patients who are discharged from hospitals. Yes.
Dallas just got one of those grants through our public health hospital in Parkland. And Parkland's partnering in the community with community-based organizations who are seeing patients who've either been discharged or are pre-admission to the hospital, and are trying to identify a continuum of care and a continuum of cooperation on behalf of those patients so they don't readmit. I mean, they're trying to do the two things at one time. One, capture them before they get to the hospital and prevent them from getting there, or if they've been discharged from the hospital, follow them where they're going through community-based care. Are they popping up in our mental health groups? Are they popping up other places? And if so, identify what they need at that point in time so they don't readmit to the hospital. And the particular method they're trying to figure out is a shared client database. We've suggested that big shared client database is not going to work, but that there are some connections that will work. And so there's some opportunities for councils looking at that piece of identifying populations and how do you make that seamless care connection. There's some opportunities for councils in that area.
Is there, around the homeless population, there's the interagency task force, and there's been a lot of effort to transform the federal agencies. There's a crossover between transportation and housing. We're seeing a much better integration at the federal level than we've seen in the past. The Part F has provisions in it that also encourage that. But on the healthcare side, is there any evidence of interagency cooperation to address issues of transportation in healthcare, so that as we're looking at transformation systems, that we're not still in the healthcare silo because there's so many other barriers. So is there any evidence of that happening? Because I don't see it in healthcare as I do in.
You're right. There is not a government initiative out there right now, but there are initiatives. One of which that we participate in is the 100,000 homes initiative, where that's what we're trying to do. Is if it's not going to come top down, we would like it to go from bottom up. And so, if the extent that you can take this and make it work in your local communities, the more that there are. Not everything comes from CMS says you must do this. There are things, and this is the great thing about the local communities is CMS only knows it from the nationwide view, but you know your local communities really well and know the patients and know the services and the resources, and this is actually where some of the better work can be done. But yes, there are lots of nationwide initiatives, and the 100,000 home is the one that I know of that's a little bit broader.
It's just a pity. I mean, yesterday we heard from a lobbyist type who is not working with any of the other agencies, but is working within his own membership, and yet saying to us, oh, oh, you know, you need to collaborate at the local level, and, I mean, then this is just another example of, here's what you need to do at the local level, versus we're not gonna do it at the top. I mean, it's just disappointing.
Okay, I know I'm almost out of time, I just want one more,
Okay.
one more slide. The last thing on this is the Innovation Center. It was appropriated $10 billion over 10 years, so this is not, nobody has to go back to Congress to ask for this money. And it got very broad authority to test various payment and care delivery models that would increase quality and lower costs in the Medicare and Medicaid programs. And then if any of these models are proven to work, then the Secretary, without any other authority, can just implement it for the entire Medicare and or Medicaid program. So this is one, and Innovation Center website, if you haven't checked it out, you should. They're just soliciting all sorts of ideas that work in your local community, and they're looking to test it to see if it can be replicated. So to the extent that you already have pre-formed coalitions that work for a particular situation, this is a place that you can go and tell CMS that this is something you should, one, throw some money at in your local community, two, to try to see if you can